So my name is Cristina, and I first learned that I had fibroids in 2019. That's the first time that a doctor actually ordered a scan and was able to see that I had multiple fibroids. And I always knew it was inevitable because my mom, all of her sisters, her mother had all had fibroids. So every year when I would go for my annual exam or my women's wellness exam, I would let the doctors know that was my history. And so 2019 was the first time that a doctor actually ordered imaging, and I learned that I had several. I think at the time the biggest was, it was less than 4 centimeters, I believe, but I think 3 centimeters or so was the biggest one. I wasn't having any symptoms that I was aware of. I did notice a little, like in my lower abdomen area, I did notice like that it was getting a little bigger, but honestly, just at this point, I'm 38 years old, and that would have been 4 years ago. So I just thought maybe it's just getting older and getting a little bit, extra weight around my midsection, but it was very concentrated. So other than that, I didn't have any of the, I guess, the worst symptoms that a lot of patients deal with. I would say it's kind of a long 4-year journey, but really a long journey that I've had since January of this year. So at the time when I first was told I had fibroids officially and saw the imaging, I actually spoke with that doctor, that doctor, and asked, okay, so I know that my mom and all of her sisters have had to have hysterectomies, but they also, this was later in life for them and they had already had children. I was younger than they were at the time when they went through hysterectomies, and I was not sure of what I wanted for, potential future fertility. And so I did speak with the doctor at the time. It was just my regular OBGYN, and she actually kind of poo-pooed me and told me, since I wasn't having any symptoms, she didn't understand why I was asking her about what my potential options would be, which I wish I could go back and talk with her now and let her know, because I kind of pushed her to tell me, I said, I know at some point it's very likely that I will need some type of intervention for these just because of my family history. I've been able to see it firsthand. And so she basically told me, there's basically laparoscopic surgery and there's a hysterectomy. If you don't want kids, you should just get a hysterectomy. And this was when I was 33 or 34, hadn't made those decisions for myself yet. And also just felt really put off by the doctor telling me, I don't know why you're here in my office. You don't have any bad symptoms, so you should just live with it. And deal with it later when it causes issues. So the reason I say I wish I could go back and talk to that doctor is because I was then kind of really put off by it, but eventually moved to where I live now in Texas and had another healthcare provider and decided to, do what I always did and tell them about my history. But I wish that I would have had a doctor at that time that was more proactive and told me to be more proactive, because I would have probably asked for and maybe demanded imaging every year. I didn't. Instead, I would just tell my doctor every year, I have fibroids. They would do a manual exam and say, yep, they're still there. But without imaging, we really did not know the size that they would eventually grow to, which at the point in 2023, when I went to my doctor, I said, I'm noticing a sizable difference in my abdomen to a point where clothes are not fitting anymore and it's very concentrated. And to be honest, I was really nervous while I waited for my appointment, because it's only once a year. As I was waiting for the appointment I had on the books, because I said, what if this is actually something else in my abdomen? Something unrelated. It could be a tumor or cancer, because I felt like there was pretty significant growth to the point where I could run my hand over my abdomen and could actually feel them, and could see different sizes of different sides of my abdomen, could see how clothes fit differently, stopped wearing certain clothing, couldn't wear other clothing, but also remaining the same size in all other parts of my body. So eventually it got to the point where I started speaking with my doctors, my current doctors, and I had multiple doctors because they actually had referred me to a couple of oncologists, a gynecological and a surgical oncologist, and everybody's recommendation was, your fibroids are way too big. If you would have handled them sooner, you would have had the option for laparoscopic surgery or other avenues. They talked with me about embolization, about medication, about laparoscopic surgery, explained why that was not an option for me because of the size of them, and everybody suggested a hysterectomy. At least 3 of my doctors recommended a hysterectomy, and that would have to be through the abdomen, because of the size of my fibroids and the fact that I had, they said, never given birth to a child before, that there's no way they could remove it vaginally. And I didn't want to have a hysterectomy, so I kind of demanded to continue to explore my options and said I wouldn't want to be referred to a minimally invasive surgeon. I did meet with a minimally invasive surgeon specifically, and he said we could probably go laparoscopically and get the one big one. And at that time, I think that my imaging, they thought it was possible that I had 7 or so, but they couldn't really see because they said my abdomen, and I remember seeing all the imaging, a CT scan, an MRI, sonogram, ultrasound, all of them, that my abdomen, because of, I guess, my smaller size, my abdomen was just completely full, and they weren't sure where one fibroid ended and the other one began. So the minimally invasive surgeon said, I could try to get the one big one, and the other ones that are there, you could wait a few more years until they grew big, and maybe you'll have some other options at that point. Science might advance in that time, but they're just way too big, and there's too many for us to do much else. And I was lucky enough to have a colleague of mine who had been through a lot of this similar stuff and had an experience with fibroids. And I really have learned a lot in advocating for myself and also speaking to other folks about this. I now know how common fibroids are, but a lot of people just don't talk about it. And I was very thankful that I did talk about it with a colleague who had had surgery at the center and had given me contact information and said, you might want to check into this, since everyone here is telling you hysterectomy, it's worth a shot to get a consultation.
Yeah.
Because I think in my mind, I had been told it's impossible and it's a hysterectomy through a scar that was going to resemble a C-section. And so I couldn't quite wrap my head around. I was like, maybe, when I actually talk with the doctor, I got to see if this is actually what I qualify for or what I might be able to get. And once I spoke with the doctor, I had a lot of questions about, but is it really an incision through your belly button and then a small incision? And how exactly are you going to get potentially what we thought at the time was, I think, a 15 centimeter fibroid out of this tiny, and then that's just one. And so I was just like totally baffled. And so I had a lot of questions, and I think a lot of disbelief. I was just like, but you've seen all my imaging? And so that was a lot of my question. Recovery time was also a question, because I was in the process of, I had already accepted a new job and was ending an old job. So I knew timeline wise, I was trying to see if I could fit this into my schedule and what recovery would look like. And also a lot of questions that after the conversation with the doctor, that I dealt with a lot of the folks that were dealing with insurance and billing, again, because I was switching jobs, insurances, and of course, because of my fibroid journey from just this year alone, had a lot of interaction with the medical system and had to navigate through billing and insurance. So I had a lot of questions about that too. And then I think one of my, just aside from the actual procedure, was just like, realistically, how many of my fibroids could you actually get out, and what does it look like post-surgery as far as like monitoring or following up, or and also like which I had kind of already, the whole reason kind of going here, what is my potential fertility option. The doctor was very thorough. We actually had a phone conversation because I'm in Texas, but also I was traveling at the time. And I was just super grateful that I was able to have the consultation period. And then, so she answered all of my questions. I think it's still a little bit in disbelief. I was like, could this be true? After all of the, in my mind, bad news I had received about your only option is a hysterectomy. So I still was a little bit in disbelief. But yeah, so at the end of the day, I went with the LAM procedure, which is what the doctor had recommended. And they found 16 fibroids. And I think before in my imaging, they had thought maybe around 7, but of course couldn't be sure. So 16 total were taken out. The largest one ended up being, I believe, 16 centimeters. Some of the smaller ones were small, maybe the size of like a pinky nail. So those they probably didn't even register on the imaging, or were, hidden behind other stuff. And then definitely a few that were the size of, I remember asking the doctor after in our follow-up, because I had seen the imaging in the pictures. And I said, how big is like one of those? Because there's a ruler there. And a few of them were maybe about the size of like little cuties or tangerines. So I had 16 there, and the doctor said they were able to get all of them, anything that they could see and feel. And that should be all of them. And I think the other thing that was pretty wild to me was that I had no idea that I had endometriosis. And while I was in surgery, they found endometriosis as well that they were able to remove. So that was, post-surgery, and then later on my follow-up consultation that I talked to the doctor about, and just couldn't even believe, but was so grateful that that was found, because of course that could have caused more problems later on down the road. Unbelievable. It was pretty crazy. Again, I had read and asked questions, and I actually had somebody in my life who could tell me their experience and tell me more about physically what your body goes through. But I was still pretty pretty shocked. So I had surgery on a Thursday and I went home. Well, I was in Maryland traveling. So I went back to the hotel same day. And I would say I was quite shocked that my abdomen was not, like my midsection was not in a lot of pain. The most pain that I had, or I wouldn't even, I guess it would be called pain, discomfort pain, was from actually the CO2, from when they, fill you with the CO2 to create space to complete the surgery. And I had been told, luckily, before surgery and then in post-op, that I needed to move around, every few hours and make sure you're moving. And that was a way to break down the CO2. So I would say the first and second days, I did experience discomfort, just like the nurses had told me, that some people experience it in their shoulders or back or chest, and that you just have to break it down and by moving. And so I did experience some of that, which was quite shocking because it's wild to think I had surgery here, but I'm feeling something up here. But I was really grateful that the nurses had given me that information. You don't know, maybe you don't know questions to ask. Will I feel pain in other places? I didn't know that was a question to ask. And I had actually, so I'm glad they told me because I was aware the first time I felt it. But as far as my midsection went, I didn't have much of any pain at all. I had spoken to my doctors here, and then of course the doctors and the nurses at the facility leading up to, when I received the call to talk about my blood work and pre-op instructions. I had asked questions about what can I do to try to put my body in the best position possible to recover. And I know that the pre-op nurse had given me some good information about, upping my protein intake, making sure my vitamin D levels were high or good, normal and high. And I also had started doing some stuff about a month or two before, as far as like healthy eating and doing my best to do some workouts that would strengthen my midsection, like Pilates and yoga at the advice of one of my doctors here. So I can't speak to other people's experiences, but I do know that I had a really relatively easy recovery. Everybody in my life, including my mom, who of course had a hysterectomy, about 20 some years ago, and had C-sections with both of her children, everybody was pretty much in awe how quickly I was able to bounce back. So I was, able to walk around and do stuff the same day, but was trying to take it easy to allow my body time to recover. And by Sunday, after my Thursday surgery, I was able to fly back home to Texas. And I basically spent a week, and not even a full week, but maybe 4 days when I got back to Texas, trying to take it easy, watching TV. But I was able to get up and take care of myself. My mom was with me, but I was able to make my own food, take my dog out, do things. I was just trying to, keep it easy. I wasn't trying to work out right away or anything like that. But by the following Monday, I had started my new job and was able to go into the office. I was cleared to drive and do all of that once I was done taking the more serious pain medication. But actually for like the first week, I just was taking the bus to work, so that I didn't have to put a seatbelt on just in case. And actually I've been taking the bus to work ever since. It ended up being a great option because I live so close to work. But yeah, so I was able to, I would say 2 weeks later, once I spoke to the doctor in the follow-up conversation about pathology results, I had asked her, am I cleared to go ahead and start working out again? And one of the things I had been doing was Pilates and yoga. And she said, you're able to start working out. And honestly, you could have probably started working out over the last week. Just take it easy, start slow and listen to your body. But I had no issues whatsoever. As far as like the surgery really did not prohibit me from doing anything. The only thing maybe was like, I didn't wear jeans for like a week just to make sure to keep the area free of any kind of constraints. But that was pretty much it. The only thing I think would just be the pain from the CO2, but it wasn't unexpected because the nurse had given me information about it. But everything went according to plan and smoothly. I mean, when I had spoken with the nurse with the pre-op instructions, they knew I was traveling from out of town, so they were able to send my medication ahead of time so I could pick it up and take it with me, so we didn't have to worry about trying to get a pharmacy in Maryland when we didn't, have access to a vehicle. So no, I think the only unexpected outcomes were, to me, once I was able to take off the little steri strips. I was shocked at how little my scar was, but the actual scar that I have is so tiny. It's lower than I thought it would be, it's shorter than I thought it would be, and it's thinner than I thought it would be. And I think I was kind of going off an assumption because when I was 16, I had my appendix removed because my appendix had ruptured. And because of, and that was over 20 something years ago. So I have a scar from an appendix from my appendix surgery, and that one is longer, thicker, more noticeable than the scar that I have from this surgery. And this surgery scar is a new scar, and it's still far and away so much less noticeable than another scar that I have from my appendix surgery. So it didn't matter that everyone told me, my friend who had had the procedure, the doctor, the nurses. I had to see it for myself because I almost couldn't believe it until I saw it. And I was so thankful and grateful and felt very lucky once I took the Steri-strips off that this felt like kind of the end of a very long journey that I had gone through, most specifically in 2023. And I know that there will be continued monitoring and that, I may need intervention in the future, but this really was just felt like such a relief and such a weight off my shoulders, and actually an actual weight off of my body when speaking to the doctor about pathology results that all came back in good shape. I believe she said that my fibroids collectively weighed about 2.2 pounds. So pretty substantial for my 5'2" small frame. Yeah, I think I'm going to echo the same thing that I've now heard from a million women, which is, don't be afraid to get a second opinion. I think so many times, myself included, I am a lawyer who advocates for clients every single day. But when it came to being in a health situation, I've been blessed to have very good health and have not had much interaction with the medical field hardly at all as far as my health goes. And it was a very interesting feeling to go into a doctor's office and multiple appointments. And at the end of the day, having to tell my several doctors, I'm not taking the medical advice of getting a hysterectomy, and instead I want to get another opinion. And, I think it can feel strange for somebody to say that to their healthcare provider. But, I think it's worth it. It's your health, and only you really know what's the best situation for your body. So that would be one for sure. Don't feel afraid to get a second opinion. I think the other thing too would just be, I had such a wonderful experience with the center, and I wish that I could, and I guess I am doing it now. I wish I could tell many people about it, because I know that they help with not just fibroids and endometriosis. I mean, I know they also have options for minimally invasive hysterectomies if that's where somebody wants to go and do. But I think it's worth it to definitely get the second opinion, and just to know that you have options out there. I think spreading the word and telling people that you have options, and knowing that like even the consultation with the center did not cost me anything to get a consultation. So there was nothing to lose by getting the consultation. But yeah, so just making sure that you know what your options are, not being afraid to get a second opinion, and making sure to advocate for yourself and what's best for you and your life and your body. I've seen a lot of doctors, nurses, radiologists, folks that are doing the imaging, people that take the blood work since the start of this year. So I have a good representative pool. But I cannot speak highly enough of everybody that I've worked with at the center. And I'll say that's everybody from the initial patient intake coordinator who emails and speaks to you on the phone about what paperwork or imaging or documents we need in order to start a consultation. That woman was wonderful, answered all of my questions, responded timely, even with a time difference. So if I called after I got off of work here and they were already closed, I received a call like 8 o'clock the next morning. So she was great. And then I moved along to speaking with a doctor for a consultation. Of course, the doctor was great and answered all of my questions. After that, I spoke with the folks who would be dealing with the insurance and the billing. Also women. And they were great. They answered all of my questions. They emailed me, they followed up. I think I was also in a situation, as I mentioned earlier, where I was transitioning jobs and I would be transitioning insurances. And for that, I was hoping to be able to have my surgery between the two. And they were able to push up an appointment that I had scheduled, knowing that I was on a tighter timeline. And I really appreciated that, because that then led to later appointments, which meant that I could, earlier appointments, but my later appointments could be moved sooner, which facilitated being able to actually use my insurance that I was on instead of having to wait months, for a waiting period with new surgery. And then when it actually came to the procedure, the pre-op nurse, the post-op nurse, the person who administered the anesthesia, the doctor day of, and then meeting also with the doctor the following day for my next day follow-up, and making an appointment with the appointment scheduler there in person before leaving that day. every single person that I dealt with at the center was super kind, thoughtful, and thorough. And I actually made kind of a joking comment to the scheduler when I left the center. And I said, is it all women who work here? Because I've only been in contact with women and everybody has been great. And she said, we do have a few men that work here, but predominantly we are run by women. And I said, well, y'all are running a well-oiled machine. And so like everything was handled so thoroughly, paperwork, post-op, pre-op instructions, everything. There was always somebody accessible to speak to every step of the way. But aside from that, they were all just really kind, which, like I said, this was kind of ending a long journey for myself that at times was scary and at times sounded really final, the word hysterectomy. And so a very nerve-wracking and scary, because I mean, the last time I had surgery is when I was 16 for an appendix. So, a scary time for people, and they were all very kind and thorough. So I really appreciated that.